Well, hey, everybody. Welcome to the 2021 State of the Community Address, brought to you by the Thomson-McDuffie Chamber of Commerce. And although this is the first year that we're holding this event virtually, it will still follow in the same manner that you've seen in previous years. We really hope that you found today's information to be a window into all of the great things that it's going on and happening in our community. Now, today, our event is being sponsored by our good friends at Waste Management. And through their generous sponsorship, we're able to utilize this video platform. It's really great. Waste Management, thank you. Your investment today is greatly appreciated. I'd also like to point out today that we are so grateful for the continued support of our membership and everything that they do for us by investing in the Chamber. I'd also like to give special thanks to our Chamber champion members, who you can now see on the screen. In between our Chamber champions and their additional investment in the Chamber, we're able to reach out and do bigger and better things every single year. So thank you once again to our Chamber champions, as well as Waste Management, for sponsoring this event today. Now, to get things started today, I'd like to introduce you to our Government Affairs Chairman, David Russell. David, take it away, buddy.
Thanks, Butch. David Russell. I'm the chairman of the Government Affairs Committee through the Chamber. Just a little bit about what the Government Affairs Committee does. The Chamber's Government Affairs Committee is at the heart of the organization's mission. Is to be a leading and a most effective advocate for pro-business and quality of life issues in McDuffie County. With that in mind, your Chamber and volunteers work year-round to ensure that our city, county, state, and federal representatives are aware of the issues which affect the McDuffie County business community, and that they're actively engaged in our efforts to make our area an even better place to live, work, and do business. Locally, governmental issues are monitored by the Chamber's Government Affairs Committee, which meets monthly to consider issues pertinent to its area of interest, and makes recommendations to the Thomson-McDuffie Chamber Board of Directors on issues that require action and/or advocacy. Chamber staff and volunteer leaders maintain close working relationships with members, as well as the leadership of city and county departments. Our Government Affairs Committee works diligently to bridge the communication gap between local and area businesses. If you have questions or for any of these panelists presenting today, please post it in the comment section at the bottom of the screen, and we'll address them at the end of the program, time permitting. A little bit about our first presenter, Sam Perren, who's representing UGA Archway Partnership. Sam joined the University of Georgia Archway Partnership in January 2017, and he serves as the Archway professional for McDuffie County. As Archway professional, Sam helps local stakeholders identify shared community and economic development priorities and connects the community with UGA resources. Sam began working with McDuffie County in July 2018 after serving in Pulaski and Colquitt counties. He received a bachelor's degree in history in 2011 and a master's degree in public administration in 2015, both from University of Georgia. Sam is now pursuing a PhD in public administration at University of Georgia. Prior to joining Archway, he worked with the Middle Georgia Regional Commission, where he focused on a variety of local government assistance projects, including planning, grant writing, project management, ordinance and policy development, and economic development. A native of Dallas, Georgia, he now resides in Athens.
Well, thank you, David. Appreciate the opportunity to get to share with everyone today. And thank you to David and Butch and Debbie and the whole team over at the Chamber for inviting me to be a part of this event today. I'm excited to share a little bit about the Archway Partnership and our work in McDuffie County. And we can go ahead and go to the next slide there. So the Archway Partnership is part of public service and outreach at the university. As you may be familiar, the university has a three-part mission of teaching, research, and service. We're a land-grant institution, which means we take that service mission to serve the whole state very seriously. And the Archway Partnership is part of how the University of Georgia does that. Specifically with Archway, we connect communities like Thomson-McDuffie and Deering with higher education resources, our students and faculty on campus, to address your locally identified community and economic development issues. We can go ahead and go to the next slide. So this slide shows all of the places where we work. The counties in red are the counties where we are currently active with the Archway Partnership. So you can see we are spread out around the state, and we primarily work in rural Georgia. The way our process works, we can stay on that slide for just a second. The way our process typically works, we have the Archway professional, who's a public service faculty member of the university, like myself, who's based out in the community. So I work in Thomson every day, connecting people here with resources from campus. When we first get started in a community, we ask everybody in town for what you think the biggest priority areas are for us to work on together. And from that, we form what we call issue work groups that work on each of those priorities over the next several years. Sometimes it's just a matter of getting people in the community around the table together to share ideas, and the expertise is already there. We already have it right here. It's just a matter of getting people around the table talking to each other. Other times, we're able to connect back to the university to bring in students and faculty to address the community's needs with their expertise and their resources. So we can go ahead and go to the next slide. So the first one of these priority areas that we've identified that the community told us you wanted us to work on together was community image and communications. So we've worked on this quite a bit over the past few years. You can see some of the goals that group has been working on. They actually met this morning and refined their goals a little bit for 2021. That photo there on the bottom, that's Ivory's Restaurant. Y'all may have noticed a lot of changes there recently. This is in progress. There's still more to come with the doors and other aspects of the building. But that's just one piece of the downtown RSVP plan that we've been working on for the past couple of years. You've seen lots of changes in downtown, and we're excited about that and excited to see that continue to move forward. That's been one of the big accomplishments for the Community Image and Communications Group so far. We can go to the next slide. Economic recovery. So just this past year, with the pandemic and everything that came with that, our local executive committee asked us to take on another priority area of economic recovery from the pandemic. They identified the 4 bullet points you see there as the chief things they want that group to work on. I like that photo there because it shows a vibrant Thomson back several decades ago and wanting to build something like that, as we come out of the recovery from the pandemic. So lots of exciting things there to come. I think you'll see a lot more about that this year. And if you want to be a part of that, please reach out to me. We'd love to have everybody in the community be a part of this group as we're building plans going forward. We can go to the next slide. Education and workforce development. We have a great partnership with the McDuffie County School System, the Chamber of Commerce, Augusta Tech, WorkSource East Central Georgia, and local industry. And that group has really been a place where our role has just primarily been to bring everybody together every month to talk and share ideas. And we've got great partners there, and they've accomplished so much. The school system has great programs like the Jumpstart Apprenticeship Program, the Welding Lab, all those sorts of things where they've been able to just do some tremendous things in partnership with industry leaders around that group. We can go to the next slide. So health and wellness. You can see the hospital there, one of our key partners in that group. This group has 3 kind of primary goals that they've identified: promoting healthy lifestyles and positive mental health, as well as addressing food insecurity. And we're really excited here about some new kind of burgeoning partnerships we have in that group with the recreation department and their walkers club, continuing to develop and strengthen our partnership with the Family Y on several initiatives, as well as Manna, the food bank, and Augusta Locally Grown with some farmers market opportunities coming up. So lots of exciting things happening there in health and wellness. We've also had students do a lot of research on health and wellness resources locally available in the community and been able to share that with people online. We can go to the next slide. So leadership. We've partnered quite a bit with Leadership McDuffie over the past couple of years. We were able to connect them with some people on campus from the Fanning Institute for Leadership Development to totally revamp and revitalize the Leadership McDuffie Adult Leadership Program. We've also got a strong partnership with Youth Leadership McDuffie, and we've worked with a group of local stakeholders, our Leadership Issue Work Group, to develop something called the High Potential Leaders Program, which is a new advanced leadership program. The first cohort of that program is about halfway through. David Russell, who you saw at the beginning, is actually in that class, and we're excited to see that group move forward after this year. So we can go to the next slide. So that's just a quick overview of everything going on with Archway. Each of those priority areas we talked about has an issue work group. And if you'd like to be a part of it, please contact me. You see my contact information up there on the screen, email and phone number. Would love to hear from you. This process is always at its best when we're hearing from everybody and everybody's involved in helping identify those community priorities that we can work on together. And we're thankful for the opportunity to work on it here together with all of you. We do have local funding partners, including everybody you're going to hear from today. So we're thankful for the opportunity to get to be a part of what's going on in Thomson-McDuffie.
Thanks so much, Sam. I know we all appreciate you and everything you're doing in the community. So thanks for telling us a little bit about it today.
Thanks, Dave.
Yes, sir. I believe we have a commercial up next from Waste Management.
The world is changing more rapidly than ever. To succeed in the face of this change requires agility, adaptability, and above all, a resilient spirit. And our 42,000 employees are up for the challenge. That's why we're launching 2 new sustainability goals focused on our planet and our people. First, for our planet, we'll offset 4 times the greenhouse gas emissions we generate through our operations. And we're already on our way. At our landfills, we're capturing methane to power homes and businesses. And we're even producing renewable natural gas to fuel our trucks. We're replacing almost 1,000 diesel trucks each year with alternative fuel trucks. A third are running on the renewable fuel from our landfills, which reduces emissions by over 80%. As the largest residential recycler in the U.S., we're helping our customers better recycle to have the greatest environmental benefits. We're also turning organic material and food waste into fertilizer and renewable energy. And we're investing in the future now with new technologies. We're piloting the use of first-of-its-kind driverless equipment at our landfills. We're building recycling plants that produce far cleaner materials at the end of the process while reducing costs. And our new state-of-the-art organics processing plants will significantly advance organics technology in North America. Second, for our people, we're making our company a better place to work and our communities better places to live by focusing on safety, resiliency, and sustainability. We support events, programs, and organizations that are as varied as the thousands of communities and individuals we serve. And we strive to be a company where employees are proud to work and proud of the legacy they're leaving behind. We see these qualities tested and proven countless times daily by our employees who manage the environmental needs of our customers. Because we're all in this together, and together we're making a difference and leaving the world a better place.
Okay, next we're going to hear from Bob Kepshire, who is the administrator at University Hospital McDuffie. A little bit about Bob. So he's been with University Healthcare System for 17 years, and he served as the senior administrator and chief nursing officer of University Hospital McDuffie since December 2015. He recently assumed additional administrative oversight for University Extended Care, which is comprised of 3 skilled nursing facilities located in Augusta and Evans, Georgia. Bob has 35 years of experience as a registered nurse. His clinical background was in emergency, trauma, and critical care. Bob has 30 years of leadership experience in both nursing and hospital administration. Bob graduated from Purdue University with the following degrees. There's a lot of them. Bachelor of Science in Landscape Architecture, Associate in Applied Science in Nursing, Bachelor of Science in Nursing, and a Master of Science in Nursing. He also earned a Master of Arts in Pastoral Studies and Theology from St. Leo University and will graduate with an MBA this May from the University of South Carolina in Aiken. He's held a certification in executive nursing practice since 2010 and is a member of the American Organization of Nurse Leaders and the Georgia Organization of Nurse Leaders. Bob has served on, as well as chaired, several national committees with the Emergency Nurses Association, the American Organization of Nurse Leaders, and the American Hospital Association, as well as the Robert Wood Johnson Foundation. He's a member of the Thompson Rotary Club and the executive committee of the Thomson-McDuffie County Archway project. He and his wife Kathy are originally from Northwest Indiana, and he's lived in Evans since 1998. They have 2 adult children and 3 grandchildren. Bob is an ordained Roman Catholic deacon for the Catholic Diocese of Savannah and is assigned to St. Teresa of Avila Catholic Church in Grovetown. In his spare time, Bob enjoys hiking, fishing, cycling, cooking, and reading. So Bob Kepshire.
Thank you, David. Nice to be with you all. Well, on behalf of all the employees here at University Hospital McDuffie, we really appreciate this opportunity to kind of give you an update on the state of the health here in our community. Next slide, please. Our mission is to improve the health of those we serve, and that's what we try to do here every day. Next slide. I think if I can sum up the health concerns for this past year, I think we could just say it in 2 words: COVID-19. Next slide. This is just some Georgia demographic data that was accurate as of this past Monday. And you can see how many confirmed cases we've had in the state: over 700,000, McDuffie over 1,000, Richmond County over 17,000, and our neighbors in Columbia County, almost 10,000. Next slide, please. I think this one is really kind of compelling. It shows the number of cases in McDuffie County. And if you looked at to the left there in April, that's when the pandemic really first started taking off in the country. And you can see where the numbers were. You can see where things dropped in late spring, early summer. And then when we had that huge spike after 4th of July. Things started to trend down toward the early fall. And then with the holidays, we can see to the right there where we've been with both confirmed cases, hospitalizations, and unfortunately deaths. Next slide, please. So this is the death slide, and you can see again where those spikes happened, where we had those outbreaks of COVID, the number of deaths that have occurred during those periods. And this last round, last spike of COVID was pretty devastating as far as mortalities. Next slide. So the pandemic's negative impact on rural hospitals. Well, prior to COVID-19's pandemic hitting the United States in early 2020, there were over 500 rural hospitals in the US that were at immediate risk of closure, mainly due to financial reasons. As a result of the pandemic, now there are over 800 rural hospitals, which constitutes 40% of all the rural hospitals in the United States, and they are at immediate or high risk of closure. Here in the state of Georgia, 26 rural hospitals, about 43% of the rural hospitals in the state, fall into this category of it being at immediate or high risk of closing. Next slide. The good news for the community is that University of Thomson-McDuffie has zero risk of closure. Even though this pandemic has had a negative impact on volumes, we are still a very strong organization. And University of Thomson-McDuffie continues to set a positive example on how to operate as a rural community hospital. We really are a standout in the state with how to do things the right way, and being part of the university healthcare system is a major reason why we're doing so well. Next slide, please. So just to kind of give you an idea of how the pandemic has impacted volumes, this is a graphic that shows since 2016, our annual volumes in our emergency department. And you can see we had a drastic decrease in 2020, and you would think, well, heck, the pandemic was hitting and that would have seen more patients coming in. But in actuality, across the country, emergency departments saw big drops in visits. It's not to say that we did not get patients with COVID, but folks that would typically come in for maybe some more minor things, aches and pains, cold symptoms, that sort of thing, people were just staying clear of the hospital for this fear of being within a healthcare facility. Next slide. We've also saw a drop in our outpatient visits. So this would be visits to radiology for routine outpatient radiology exams, or coming in for lab work, mammograms, that sort of thing. So we saw, again, people choosing not to come into the hospital. And also during the summer, we actually had about between 6 and 9 weeks of where we actually canceled all elective diagnostic procedures unless it was an emergent procedure, just to try to reduce the number of people coming into the hospital. Next slide. The good thing is we were pretty fortunate that our surgical and other operative procedures like colonoscopies, pain management, etc., really did not curtail here. We were able to keep a good handle on things in our hospital, and where a lot of hospitals were canceling elective surgical procedures, we only had a few days in there that we were not doing as many cases, but we were able to really maintain our OR just using really good infection prevention and screening protocols. So that was a good thing for the organization and the community. Next slide. Our acute inpatient days, so these are folks that are admitted to the hospital. We were down from 2019 a little bit, and you'll notice that 19 and 20 have dropped from previous 3 years. And a lot of this is driven because insurance companies are really now mandating, say, certain operative procedures that used to be considered inpatient after surgery are now considered outpatient or observation status. So that is kind of driving some of those acute inpatient days down. Next slide. our post-acute inpatient days. Our post-acute, or commonly known as swing bed, these are for, this is an admission for a patient who had been in an acute inpatient, but may need some rehab or additional strengthening or therapies. And because we are a rural hospital, the CMS allows us to then admit them almost like a skilled nursing patient that you'd see at a skilled nursing facility. Again, because of the pandemic, a lot of patients and a lot of families, if they were an acute patient, have chosen not to stay in the hospital. So a lot of swing bed programs have experienced this, as well as some of the skilled nursing facilities in the area have seen a drop in admissions. And so that's why we've seen that big drop in our numbers there. Next slide, please. And observation day totals. These are climbing, and again, a lot of this is driven just because of payers not paying for inpatient stays and mandating that post-procedural hospitalizations are not to be admitted as an inpatient, but to be admitted as an observation status patient. Next slide. So just to kind of show you the income from operations, I think I showed this slide last year when we had our in-person update. So I included 2020s, and you can see where the hospital was back in 2010, 2011. In 2011, almost $2 million negative bottom line. In 2012, July 1st of that year, University Healthcare System purchased the former county hospital. And you can see each year since then, we've grown our income from operations. We had a little bit of a drop in 19, but we kind of rebounded back in 2020. So even with the pandemic, we're still financially very viable as a small rural hospital. Some of those monies are actually monies that came from the federal government to healthcare organizations, but we have to account for how we've used those dollars. And a lot of that was to pay us ahead of time for Medicare patients, just knowing that the flow of finances for hospitals was really negatively impacted. And this was the federal government's response to help make sure that hospitals are able to keep the lights on. Next slide, please. So last year, University Healthcare System has, and of course we're part of that system, reinvested significant dollars, over $400,000 in capital purchases for your community hospital here. So we spent $3,500 in information technology, $4,500 on some work in the lab. Our emergency department, a little over $9,000. We did a pharmacy IV room. That's a special room where IVs are mixed, and there's some very strict requirements on the environment in that space. And so we did some remodeling because of some new standards. So that was over $17,000. You could see over $52,000 on just different things on the upkeep of the facility and plant operations, over $100,000 on equipment for surgical services, and over $200,000 on equipment in radiology. Next slide, please. So how can the community assist keeping university hospitals strong? Well, I think the number one thing is kind of the catchphrase that's been a University Hospital in Augusta catchphrase is assist on receiving your healthcare services here at University Hospital McDuffie. If you need to be hospitalized for inpatient or medical surgical care, or if you need acute care post-rehab, tell your physician and your provider that you want to be admitted at University Hospital McDuffie. Choose our facility for your outpatient radiology procedures, your lab tests, for outpatient rehab. And we've got some fantastic surgeons in our community. And so if you need general surgery, podiatric surgery, orthopedic surgery, pain management procedures, having your colonoscopies, choose to have those done here at University Hospital McDuffie. Another great way to assist the hospital is to participate in the Georgia Rural Hospital Tax Credit Program. You can talk to your CPA or you can call the hospital. We can give you information about that, but that is a way to offset your taxes, if you will. You still have to pay your state income taxes, but instead of paying it to the state of Georgia, you actually pay it as a contribution to the hospital, and you get a credit for that. And then communicate with your state and federal representatives and senators and ask them to support rural hospitals. Next slide. So just to let you know, for months now, we've had no visitors, and I know that it's extremely frustrating for both patients and families. And as of this past Tuesday, we've reinstated visitors with some guidelines. And so you can now come and visit patients. So you must be at least 18 years old. Whoever comes into the facility must wear a mask at all times, even when you're in your family member's room visiting. Inpatients can be visited from 9 a.m. to 6 p.m. and will only allow one visitor per day per patient. Visitation in other areas in the facility, if a patient's coming in for outpatient procedures, x-rays, or surgeries, they're allowed to have one visitor with them per day, per visit, and they can stay here in the waiting room because they won't be back in surgery, of course, but they could be here to support the patient. If you have to come to the emergency department, again, one visitor per patient throughout the stay in the emergency department. And unfortunately, sometimes we have situations where somebody may be near death or has passed away in the emergency department, and we'll allow two visitors on a case-by-case basis based on the nursing supervisor and the patient's physician, but to allow a family to come in if somebody's near death or if there's been somebody that's just expired. And of course, if there's patients that have cognitive or communication disabilities and they really need a support person, again, that's on a case-by-case basis. We'll work with the patient and the family to assure that they have a caregiver that can be here with them as needed. So again, I want to thank you for this opportunity. We are so glad to be part of your community here. We're glad we're here. We're here to meet your needs. Again, we want to fulfill our goal and our mission to improve the health of those we serve, and we try to do that every day. All I can ask folks is to stay vigilant with the COVID-19, take advantage of vaccines that are available if you're 65 and older, keep wearing masks, use diligent hand hygiene. We still have to do social distancing. We're not out of the woods yet, but the numbers are dropping. It's looking better. Someone was saying this today, we may see a spike again because of Super Bowl last weekend, so we'll see what happens. But we're hoping that we'll round the corner sometime in 2021. This year's got to be better than last year. So thank you very much.
Thanks, Bob. Appreciate all you guys do, and great having that resource locally. I think next we have another commercial from Waste Management.
As this commerce machine rolls on, things will be thrown out. It's a byproduct of productivity. We're a family of 42,000 here to help you manage it. Doing what it takes to minimize waste, recycle it, even power our trucks with it. So long as things are thrown out, we'll be there to take care of it the right way. It's not just waste collection, it's waste management.
All right, next up we have Dr. Mychele Rhodes, who's the Superintendent of McDuffie County Schools. As Superintendent, it's Dr. Rhodes' great privilege to work with parents and students and teachers and members of our community to provide the best opportunities available for every pupil in our school system. Her education includes a Bachelor of Science degree in Education from Georgia Southern University, a Master's degree in Education from Georgia Southern, an Educational Specialist degree in Educational Leadership from Augusta University, and a Doctor of Education in Educational Administration from Georgia Southern University. Dr. Rhodes is also honored to be selected as a member of the first cohort of the Georgia School Superintendent's Executive Training Program and a member of the Georgia School Superintendents Association. This year is Dr. Rhodes' 28th year as an educator with 25 years of service in McDuffie County. During her time in McDuffie County School System, she has served in multiple capacities, including teacher, assistant principal, federal programs director, assistant superintendent, and for the last 7 years, she's been our superintendent. Dr. Rhodes was the first educator in the district to earn National Board Certified Teacher Distinction, has led the McDuffie County Board of Education to exemplary board status, and facilitated an accreditation process which resulted in the highest results in the system's history. Under her leadership, dual enrollment, the CTAE pathway, and innovative advanced content options have flourished. As a parent with a child in McDuffie County Schools, Dr. Rhodes recognizes that it is not enough for graduates to be college ready and career ready. They must also be fully prepared to compete internationally and to meet the challenges of tomorrow. Dr. Rhodes believes a great education is the vehicle for a stronger workforce and a stronger community, and she's committed to moving our students towards success. So, Dr. Rhodes. Dr. Rhodes, you might be on mute.
I was on
There we
mute.
go. There we go.
Good afternoon. It's a pleasure to be here with you this afternoon to discuss the current state of the McDuffie County school system, to share with you all our initiatives that are in place to ensure the safety of our faculty, staff, and our employees as we continue to fight against COVID-19 on a daily basis. If we could begin with the first slide. The vision of our school system is to not only prepare our students to go into post-secondary options, but also to prepare them for careers. As Sam mentioned in his Archway presentation, we have been working with the Archway Partnership as well as the Chamber of Commerce to ensure that we have continued dialogue with the businesses in the community to prepare our students to be able to accept careers, become responsible citizens here in our community, and to engage effectively with business partnerships prior to graduating from Thomson High School. There are 4 goals in the strategic plan of the McDuffie County school system. These 4 goals are analyzed on an annual basis and then periodically throughout the school year based on the assessment data and the demographic data readily available to us. Of course, one of the challenges during COVID-19 has been that there is no assessment data from the state level from last school year. However, we have continued to assess our students locally to ensure that we are planning instruction effectively for them to be able to continue to have growth. There are 4 goals within the strategic plan of the school system. The first, of course, to increase student achievement. The second is that we continue to operate with organizational effectiveness. This involves our transportation fleet, our administrative services, and all of our facilities. And of course, good fiscal management. The third area, human resource development. We continue for the last 3 years to retain our teachers here in the McDuffie County school system. And we're excited that we've been able to begin a leadership cohort here, very similar to what Sam mentioned in the Archway Partnership in the community. And then finally, one of our greatest areas is the goal 4 of engaging our stakeholders. This school year has been, of course, a challenge as we continue to work with our families and our students to keep them engaged during virtual learning and during our hybrid model. As we look at the precautions that we've taken for COVID-19, when Bob was presenting, there was a slide that was very telling for our state as well as our community. And if you looked closely at that slide, you would see that the peaks and the dangerous peaks of COVID occurring in late July, early August, and then late December and early January are both crucial times for schools. The onset of the school year in August, and then the onset of the second semester in January. The spikes that we have seen in our community have been a challenge for us as we continue to bring our students in, keeping them as safe as possible. There are several pictures that you'll see of mechanisms that we have used to ensure the safety of the students, the faculty, and staff. Of course, the first on the top left, these are supplies that have been sent to all school districts by Georgia Emergency Management Agency. We in turn also have purchased additional supplies for our students. Masks are required in McDuffie County schools. We do require them as well on McDuffie County transportation. You see the standing hand sanitizer. These were purchased, of course, during the spring of last school year into the summer. These are located, these are the touchless hand sanitizers. They're located at every entrance and in every commons area of our 7 facilities. The forehead thermometers, we are not allowing visitors past the front office of each school at this point, but temperatures are checked upon entry and masks are required. And then the final picture, you see the markers that we have in place in all of the schools. This ensures that our students, particularly our younger students, understand the appropriate distance for 6 feet apart. So we have placed markers to help them to remember this. One thing that is not pictured that I'm very proud that we have instituted as a school system, we purchased bipolar ionization units throughout the district. These are now in all 7 facilities and in the central office. The CDC guidelines that are going to be announced tomorrow, one of the recommendations that the CDC has in place is that all schools in their reopening have ionization systems. And I'm proud to say that we do have that in all 7 facilities and the central office at this time. Instruction has been different, to say the least, and we've had to find ways to reach our students as well as teach them the appropriate way to remain safe at school. In the top left corner, this is a Thomson Elementary student who is engaged virtually with his teacher through Google Meet. As a K-12 Google district, we have utilized Google Classroom to provide both live and recorded instruction for our students and individual conferencing with those students to be able to administer our assessments as well as answer student and parent questions. The bottom right corner, you see this, this is an elementary student, an upper elementary student that is in the car with her family, parked at one of our Wi-Fi access points in the county. And you'll see in the back top right corner of that picture, there's an SRO vehicle. We purchased Wi-Fi Ranger units for all of our SRO vehicles, as well as portable units that can be taken on buses. We have 8 different wireless access points for our families throughout the day and in the evening hours at night to ensure that students can go to these access points if they have limited internet availability at home, to upload their lessons, review any assignments, and be able to communicate. You see the Chromebook that is in the young girl's hand. We purchased Chromebooks for all of our students that needed a Chromebook to be able to participate in virtual learning. And we also purchased hotspot access points for students as well. The other 2 pictures show how our students have adapted to being at school with masks. And I will say that our elementary students, they wear quite cute masks that match their clothing on a daily basis. You see many of them have characters on their mask, but I am quite proud of the student body and how they have handled being able to be on campus and wearing their mask. Sam mentioned in his presentation the welding program as a result of the partnership between Archway and the Chamber of Commerce and the need in our community to have trained welders. We're quite proud of the welding program. This is our 2nd year. We had students that competed at the national level and who won national level awards, and you'll see the sculpture at the bottom, that was the award-winning sculpture. And we are just quite proud of this program and our teacher, Miss Mosier. upcoming, we are asking McDuffie County citizens for their support in once again approving a 1-cent education sales tax on March 16th, 2021. This week, we've issued flyers to all of our students and employees, as well as on our school system Facebook page and web page. We have a video which shows everything that we've been able to do through SPLOST dollars and SPLOST 6. We've had significant renovations to our facilities as a result of this 1-cent education sales tax, placing new roofs on Deering Elementary, McDuffie Achievement Center, Thomson High School, and Maxwell Elementary. Significant renovations at Deering Elementary School to include HVAC, and also upgrades to the lunchroom equipment, ceiling tiles, and floors. At Thomson High School and Deering, adding secured vestibules, as well as purchasing the Chromebooks that you saw the young girl holding for virtual learning. eSPLOST is not a new sales tax. It's an extension of the current sales tax. We ask McDuffie County voters to please continue supporting our school system through the 1-cent sales tax and encourage those individuals to participate in early voting as possible. We appreciate your support of the McDuffie County school system and look forward to continuing to provide the best educational opportunities possible for our students.
Thank you, Dr. Rhodes. I know everyone appreciates all you're doing to help navigate the school system through the pandemic and continue moving it forward even through these adverse times. Next up, we have Mayor Kenneth Usry, the mayor of the city of Thomson. A little bit about Mayor Usry. He is a Thomson native and a graduate of Thomson High School. He retired from Regions Bank as president after 40 years. He served on the Thomson City Council for 28 years as mayor pro tem and has been the Thomson mayor for the past 14 years. He is a member and former president of the Thomson Rotary Club, a member of the Thomson Presbyterian Church, and a number of other community organizations. He actively volunteers in our community with the hope of making life better for as many as possible. In his spare time, he enjoys his 4 grandchildren and fishing. So, Mayor Usry.
To us today to share some of the things that are happening in our community and especially in the city. I've got about 5 or 6 items to cover, and I'll start out with the first one is our budget. For 2020, our revenues and expenses were in line, and we ended up the budget year with all funds being in a positive position. Our total budget for 2020 was $19.7 million. Our 2021 budget is at $20 million, and we anticipate being able to live within our means for the coming year. A positive thing that happened to us in January, all of you are aware that we've gone through several city administrators over the last 15 months, but we were successful in hiring John Waller as interim administrator. He comes to us he worked at Grovetown for 5 or 6 years as an administrator, and we are excited to have him on board with us, and we're looking for great things from him and his leadership to our staff and also to the elected officials at Thomson. The next item, we had several big events to take place in 2020 to help move us forward. One of the biggest things was transportation tax was approved. This tax was approved. It will not start, the existing tax will not expire until the end of 22. The new tax will start in 23. But the plus to that is there will be in the new tax about $34 to $35 million that will come back to the city and county to help us improve roads and other things in our community. Under the current transportation tax, we have a project that we have been trying to get started for quite some time. It's been bid, but we refer to it, or I refer to it as the Brickyard Project. It's It's been a long time coming. It's been bid. It was under budget, but I'm having problems getting a commitment out of DOT as to when that project will start. Another project, Mr. Chairman, will address that the county has that's coming up out of the current T-Splosh. The second part, the big events that took place in 2020 was we passed our SPLOST 7 tax. The voters, we've already started collecting those funds. The budget there is $21 million. We've got about 10 areas that those funds are spent in. And in those areas, there's probably 4 or 5 different categories. But we're excited that the voters passed that tax, because what we do with those projects and those funds relieves the taxpayers of additional burdens to try to get things done for our community. The next item that's hot on the agenda for us, not only in the city, but the county, because we have a joint water sewer commission. At the present time, over the next 5 years, we're looking at about $16.6 million to upgrade, to improve the system for the future. And we're anticipating a lot of growth coming our way, and we've got to maintain what we have and prepare for the future. I mentioned T-Splosh earlier and the Brickyard project, but I'll just close out my remarks by going back to the first presenter, Sam Perren. And I thank the folks that participated with us when we entered the Archway program and when we started RSVP. We've got a lot of community folks that stepped up to the table. And Sam's done an excellent job. Our participation from our local folks has been great. But for today, for tomorrow, and for the years to come, this Archway and RSVP is vital to our community and to our downtown area. So thank you for the time.
Thank you, Mayor Usry, for the update on everything in the city of Thompson. And we'll do another ad here from Waste Management prior to our next speaker.
You've got a business to run, a household. You're not always thinking about the things you throw out, but at Waste Management, we are. We're reducing waste at its source, generating energy from landfills, and bringing the solutions you need when you need them. Where there's waste, we'll be there. Not just to collect it, but to manage it the right way.
All right, next we've got Mayor Sean Kelley from the town of Deering. Mayor Kelley is a member of the graduating class of 1986 from Thompson High School. After high school, Mayor Kelley attended Augusta College in Augusta, graduating with a bachelor's degree in business management in 1994. After returning to Deering, Sean wanted to get involved and give back to his local community. In 2013, he opened Kelley Business Printers, a commercial print shop specializing in offset printing, and continues operations today. He's currently involved in the community by serving as the mayor of Deering since 2006. He's married to his wife, Paige, and has a daughter named Abigail. Mayor Kelley.
Well, thank you for having me. It's a pleasure to be here. I always enjoy this. It's a little odd this year talking to that camera on the wall rather than a room full of people, but we'll give it a go. And my wife will be happy. Look, I'm going to show her. I actually made notes. So anyway, things have been going great in Deering. We've been seeing, a lot of activity with the growth at Fort Gordon. We've been getting a lot of interest in, housing. Everybody saw that the other week when that came up. But in the past year, we've put in, well, we're not quite finished with one of the projects, but almost $4 million worth of commercial development with the Dollar General and the Family Dollar that's going in now. So that's great. We appreciate the, the investment in the community through those companies and look forward to the business it's going to bring over the next few years. So that's been great. Also, our community center, we got it broke in real well with all the elections that we had over the past year. I think the facility is wonderful. From the people I talked to, they thoroughly enjoyed coming to the building, and it's been a great facility to have. And that having been said, we were able to host several of the COVID testing through the McDuffie, that's the health department, wasn't it, Charlie? McDuffie County Health Department came down and did several rounds of testing down there, and we were thrilled to be able to provide a great facility for them. And I think they enjoyed being able to come to that facility too. So all that went real well. Glad to see that our investment in that building paid off. So other than that, our skateboard park continues to be heavily used. I was over there this past weekend, and there was probably 7 or 8 kids in there skateboarding. It seems to be somebody there pretty much every day using the facility. Our walking track and playground is top notch, not taking anything away from the other facilities in the area, but ours is probably the nicest one, and is heavily used. The walking track especially as the weather is starting to improve. There's people over there all the time walking. So we will continue to keep that track at a high level and make it the center point of our community. Proud to have that in our area. Other than that, it's been an interesting year with the COVID and everything going on, but fortunately, it looks like our restaurants not only survived, but they've actually been thriving. I know Steelers is still doing well. Pea Ridge is always packed, and you know how good food is when people are willing to stand outside for the food rather than be able to go in and sit down, but there's lines over there all the time. And I know Deep South Cheese has really been busy. They do a great job with their takeout, and now they're back into their dining room. So if you have a chance, come down and check out our restaurants. We're very proud to have them and glad to see that they've not only survived but are thriving. The other things I want to talk about was some of the recreational stuff that's available in the area. Once again, I'm going to talk about the McDuffie public fishing area. I think a lot of people don't realize what an opportunity is out there for them. I mean, not only fishing, you always think of fishing, but that place is fantastic to go out and hike. They have hunting opportunities. I think they have dove hunting and duck hunting out there, but as far as a hiking and that area is fantastic. What are you giving me that for? I have not been 7 minutes yet. And then we're very proud that Hillcrest Farms was finally able to open their robotic facility for tours. I think that was in the spring or sometime they got that going. So if you have time, give them a call, set up a tour. They do it by appointment. So if you're interested in going out there, make sure you give them a call. I know it's on their Facebook page, but it's a great facility to see. And it is still the only robotic milking facility in the state of Georgia. So take some time, go out there and check that out. What's coming up? Just this week, I've been speaking with somebody with the American Heart Association, and they are interested in possibly doing a farmer's market in Deering. I'm not sure exactly where we're supposed to meet next Friday on that and discuss that. So as we get that news together, we'll get that out to everybody so everybody knows what's going on with that. Also, today just spoke with the Family Y about possibly doing some summer camps or some type of summer program in Deering, maybe at the community center. So that's a fantastic opportunity. Looking forward to that. And our yoga classes are still going on. They go on at the community center. They're Monday, Wednesday, and Friday, and they meet at 10 a.m. There is no charge for that. Deering foots the bill for all that. So if you're interested in that, come check that out. And lastly, I just wanted to do a couple of thank yous, especially to the McDuffie County Health Department for, providing the testing in Deering. I know a lot of people, just have a little bit of trouble getting out and going different places and didn't want to have to go to Augusta University to get the testing, and being able to do it there in Deering was great for our community. And we really do appreciate them coming out. And then the Family Y, I don't know how many of y'all have noticed, but the Family Y has been doing the food basket giveaways at the community center. They've been doing that now for the past, they do it every other weekend, and they've been doing it, I think, for about a month now. They will be there at the community center this Saturday, starting at 11 o'clock. They've got 200 or 250 boxes. So if you know a family in need, this is a great opportunity to come out. There's no charge for it. Just drive through the community center, and they'll hook you up with that. But we really appreciate them thinking about us and providing that service in Deering. So other than that, I guess Kenneth wanted me to shut up a minute ago, but he was short, so I took some of his time. But thank y'all for having me.
Thanks, Mayor Kelley. Great to hear all the exciting stuff happening in Deering. I believe we have one more advertisement from Waste Management.
We are always working for a sustainable tomorrow. That's our promise. A promise doesn't change when things get tough. These are unprecedented times, And that promise of who we are and what we stand for can be seen on the faces of our 45,000 teammates. We could not be prouder of them as they continue to be there for our customers, for our communities, and for each other, today and tomorrow.
All right. Next up, we have Charlie Newton, the chairman of the McDuffie County Commissioner Office. Charlie Newton is a member of the graduating class of 1985 from Thompson High School. He attended the U.S. Air Force Academy, where he obtained a bachelor's degree in aeronautical engineering. He serves on many boards, including the Thomson-McDuffie Airport Authority, McDuffie County Board of Health, and Thomson-McDuffie Water and Sewer Commission. Charlie serves as the chairman of the McDuffie County Board of Commissioners and has since 2001. He also served as the vice president of the McDuffie County Feed and Seed Grading Incorporation since 2007. Charlie's an active member of the Thompson First United Methodist Church, and we appreciate you being here today.
Thank y'all for having me. First of all, I'd like to thank the Chamber for putting this on and for having the wisdom to say the best for last. And I also would like to thank the voters of McDuffie County for re-electing me this past year, for passing the SPLOST and the T-SPLOST. They're going to be great for our community. COVID has sort of dominated the conversation here today, and for good reason. As far as COVID, I'd like to show another shout out to the McDuffie County Health Department. They're doing a great job now getting out vaccines now that they're available. They have drive-through vaccine clinics out at Sweetwater and can get 250 to 300 people per day through there. The only issue it's caused us is a lot of times it takes the entire office, and we may not have somebody there to answer the phone. So if you don't get through, please be patient and call back. We do want to get you a vaccine if you're eligible. In relation to that, our people, I want to say a big thank you to not just McDuffie County, but all government workers. We had to be here. We had to keep the roads open. We had to provide public safety. We had to provide the court system. You're not going to find that same experience with a lot of state agencies. They went home and they're still at home. Our folks stayed because we needed to serve the people. So thank you to them. And then finally, David Crawley, our county manager, has provided tremendous leadership through this COVID situation. Back when it first came out that this was coming, none of us knew what to expect. I think we thought it was going to be a lot worse than it ended up being. Not saying it's not bad, but we had weekly meetings and sometimes daily meetings to discuss what the governor had sent down, our marching orders, and David was the one that pulled all that together for everybody. So I want to say thank you to him for that, and also getting through the year in a positive budget situation. David's done a great job over the last 6 years since he's been here, taking us from a situation where we had pretty much no reserve to a position where we have almost 6 months of operating in the budget. And that's because of his hard work and our hard work of all of our people and able to save money and put it back. Our community is growing. We have industries here. I won't mention them because they might not want me to, but they're adding significant investment and hundreds of jobs. We have 2 new industries looking at McDuffie County right now. One at the old Georgia Pacific site that burned. So that will do a lot for us being able to clean up the community. And our building permits, as Mayor Kelley mentioned, are up significantly. So McDuffie County is growing. Projects coming up in 2021. Our Northern Bypass is currently underway. That's going to connect the new 3 Points Road interchange around to Highway 17. We have a Wrightsboro Road sewer project that's going to be in the Ridgeview subdivision and the subdivision comprising Pope, Crawford, and Short. They have some significant septic tank issues over there, and we're going to put sewer in to solve that. We have finally got a bid package being put together to pave Carolyn Lake Circle. It's a new way of doing things, and if it works, it's going to help us get a bunch of dirt roads paved without spending as much on engineering as you do paving the road. We're going to rebuild the concession area at our baseball fields. The current one's gotten in bad shape. We're going to do that this year. And then finally, Big Heart Campground, as you know, the Corps of Engineers gave it up, was going to close it. We took it over just as we did Raysville. We have had some issues with state agencies and being able to get the thing back open, in particular EPD and the permit you need to operate a public well on the property. But we will be opening that this year. our 2021 initiatives, we're going to implement a fire fee. Now, before you get up in arms and see that as a tax increase, there will be a millage rate decrease to offset that. We're going to have, before that happens, we'll have some much better community information out, probably even a public hearing on that, so people know what's coming. We're considering countywide curbside trash pickup. That may be in conjunction with the town of Deering and the city of Thompson, or it may not. It just depends on how the bids come in. That's something the county commission is considering right now. And so hopefully that'll be implemented this year. Finally, and I want to say this for last because it's probably the thing that most people are looking forward to, is a major broadband initiative in this community. That's high-speed internet. It costs a lot of money. And what we need from the businesses out there, Bob out at the hospital, y'all would be a big part of this. We're going to have to go through an exercise to see who we can expect to have as customers. Should we put in the backbone of fiber? And the reason we have to do that is we're going to have to borrow money. We had $5 million in the SPLOST to start addressing that. Unfortunately, that's not going to do everything we need to do. So if you are a homeowner or especially a business, please, if you're offered a long-term contract with somebody like AT&T or Comcast, don't take it. We won't be imminent. You probably won't see anything this year, but we're going to work very hard to be ready to go to start putting in infrastructure next year to provide you high-speed internet through providers that would hook on to our open access fiber. I know that's a lot of big words, and we will have some more community information meetings so you know more about that. But we just need the members of this community to be willing to sign on to our backbone so that we can borrow the money we actually need to build it. AT&T and Comcast are simply not going to build out this community until we get much more populated, and we need the infrastructure here so as we get into environments like the COVID, that children can do their homework from home, not from the front seat of a vehicle as we have now. So thank you again for the time today, and y'all have a great day.
Thank you, Mr. Newton. Some exciting stuff there for sure. Believe we have time for questions, but I don't see where we have any. So I think we'll move right on to closing remarks from Butch.
Make sure that my microphone was not on mute as well. That was a lot of great information. Thank you so much to all of our presenters today. Thank you to our chamber champions. And also thank you once again to Waste Management for being able to sponsor this event so that we could bring it to you today. I hope you all found it all very entertaining and enlightening, and we hope to be able to do this again in person next year. But until then, have a great day. Thank you.